Before performing any type of restraint, take some time to read the animal and look for signs of fear or aggression. Piloerection, hissing, growling, averted eyes, dilated pupils, and position in the cage can be important as well. Take any necessary safety precautions for yourself and the patient. If the cat is friendly, carefully lift the animal out of the cage and support her with one arm underneath her body, using your elbow to tuck her rear into your body. You can hook your hand behind her elbows, placing your pointer finger in between the front limbs and a hand over top of the scruff in order to transport the cat safely from cage to room. For dogs, once again, look for signs of fear or aggression, such as piloerection, averted eyes, or direct eye contact, growling, head hanging, teeth baring, hunkering towards the back of the cage, and take necessary safety precautions. If you're certain that the dog is friendly or you know the dog, you can open the cage and step in front of the dog, place the lead around his neck, and lead him out of the cage and safely to the exam room, avoiding any obstacles such as hospital cats in the hallway. Okay. If the dog is fearful or aggressive, you'll want to take a more anti-aggressive stance, standing sideways, bending down to make yourself appear smaller, and using the cage door as a sort of blockade or shield from the angry dog. In extreme cases, you can use a rabies pole or other stiff-leaded leash to remove the dog from the cage if necessary. Also important when it comes to restraint, especially for examination and administration of medication or other treatment, you always want to pay attention to how the animal responds to restraint. For this cat, I was able to just place my fingers underneath the jaw and my thumbs above the ears, or the pinnae, and that was enough to restrain this cat for an eye and ear exam.
I think it's like her eyelid didn't sticks up so much.
The most important thing to remember when restraining for an eye or ear exam is allowing the doctor access to the areas being examined and keeping the head and body still. When restraining for routine physical examination and vaccinations, again, pay attention to just how much restraint is actually needed for that particular animal, and where the doctor is working and what the doctor is trying to do. So just follow where the doctor is in the exam and restrain as necessary. This cat was very good and required very minimal restraint. I basically just had a hand on him and he was just fine. I don't know why I'm dreading that part the worst, but I hate the way that I sound. Like,
I hate the way I sound.
I just sound weird.
And then we had to do our voicemail setup. I was like, ugh.
When restraining a patient, it's important to know what's going on in the room around you, as well as how the patient is reacting to any outside stimulus. If you notice the patient becoming more stressed, you may have to change your restraint technique, or if something in the room is bothering the patient, you may be able to remove the outside stimulus in order to reduce the amount of stress the patient experiences. The most important thing is keeping your eyes on the patient so that you can respond to any sort of reaction that the patient might have to the examination or whatever outside stimulus, such as, for this cat, a dog walking into the room or an unexpected noise.
You can reverse her. Okay. She's gonna get up. Look at her. She's like, look at my big blood, full of blood. All of it? Yeah. Well, do half. Reverse half. And then that way she won't shoot up. She won't shoot up and then immediately off.
He did not appreciate me taking his temperature.
No.
Okay, my appointment is leave her out until she wakes up. I can try to help you scoot her in. Oh my god, it's like the retriever. There she goes. She's going around. Make her like that. Here.
Can we just grab hand me that alcohol real quick? For your video.
Yeah.
Good boy, Scout.
Oh boy.
The basic idea of the kitty burrito is to secure the limbs of the cat in a towel so that the cat feels a little more safe in a tight enclosed space and the cat cannot scratch you or the doctor or technician examining the patient. Another basic form of restraint for the cat that is used only in extreme cases is the kitty stretch. You scruff the cat, place the forearm of the hand scruffing the cat along the spine, and stretch out the hind limbs with the other hand. This way, when the cat tries to move, it's very uncomfortable and it can't really move its head or its claws around to scratch you or the other person working with you. At that point, they can't really do anything to you. She can't scratch you, she can't kick you, she can't bite. She is totally mobilized and not very comfortable, as you can tell. This is Depending on the size of the patient, this method of venipuncture might be more easily performed on the floor than on the table. However, if you do have the patient on the table, place him or her in sternal recumbency and hook the elbows over the edge of the table, holding the forearms in your hand while using your other hand and arm to secure the head in place, pointing in a direction towards the ceiling. For larger or squirmy dogs, it may be useful to have a butt holder. This may also be easier performed on the floor for a larger dog, such as Seamus here. The best technique is to have the dog sit down, squat behind the dog, hook one arm around the dog's head and neck, turning his head away from the technician drawing the blood, and use the other arm to grab behind the dog's elbow to extend the forelimb for the technician, and use your thumb to laterally roll and hold off the cephalic vein. This method may take two handlers, one to restrain and one to hold off the vein. I found that it's typically easiest when the dog is in lateral recumbency, one person holding the down legs and using one arm to secure the patient's head, and another person holding off the vein just distal to the stifle joint. Restraint of the feline patient for jugular venipuncture is similar to that of the dog. Hook the patient's elbows over the edge of the table, secure the forelimbs, and raise the head, typically grabbing underneath the jaw.